So with these wonderful responses, I know there have been some experience with patients who had metastases in the CNS and in the brain.
Yeah.
Can you tell us a little bit more about that and what the experience was in the trials?
Yeah, so Alex Drillin will present in our series at an oral presentation this ASCO, looking at particularly those patients who develop brain metastases and also primary CNS disease. Clearly, in patients who have developed brain metastases, and there was a series of these patients, the response rates were very similar, 60% overall response rate.
In the brain?
In the brain.
Wow.
Yeah, yeah. And this is similar data to what's been reported with entrectinib. I think entrectinib response rates around 55, 56%. The CNS disease is a little bit more complicated picture, and part of this is I think that we don't have enough patients.
This is CNS primary disease?
CNS primary, glioblastoma. We know in children who have these rare oligodromas and other pontine gliomas that these responses are uniformly dramatic and significant. In GBM, for example, Dr. Drillin's data set suggests about a 35% response rate. Again, there was, I think, 6 or 7 patients on that cohort. It's hard to say exactly if that's just because of small numbers, or at this point, we need to add more patients to see what the overall response rate is. But there may be, and I say this very, only because I've seen such activity, larotrectinib, but there may be a difference in pediatric CNS disease versus GBM. With that said, a 35% response rate in GBM is in itself, it's still amazing, right?
Yeah.
It's for a disease that really has no new therapies over the last several decades.
Yeah, and we'll have to see how the responses are also.
Yeah.
In CNS, even, I know following the responses can be tricky because I know that sometimes there can be what appears to be worsening, but it's actually just part of the scan. So we'll have to figure that out.
And this is true of most of the second and third generation drugs. It's true for entrectinib. It's also true for larotrectinib, because it has high CNS penetrance. So patients with brain involvement will frequently respond. In the original phase 1 and phase 2 studies, the overall response rate, again, was on the order of 70, 75%. It was a 55% intracranial response. We would never see that with standard systemic chemotherapy, but we are seeing that increasingly with our newer generation of tyrosine kinase inhibitors. Certainly seeing that with alectinib in ALK-positive disease, brigatinib in ALK-positive tumors, but now entrectinib in ROS1, and I dare say in NTRK-positive patients, those with CNS disease are also responding.